Hi everyone, welcome to today's episode of Eat, Move, Think. Today we'll be talking about pharmacogenomics and personalized medicine. My name is Jessica Gu. I'm the Clinical Director of Genetics at Medcan and a board-certified genetic counselor. So what is pharmacogenomics? So pharmacogenomics is a science that combines medication and genetics. So when we think about medications, when we take a medication, it typically is done to treat a symptom that we may have, and the body will break that down, that medication down, and then get rid of it. Genetics comes into play when certain genetic variants can either slow down or accelerate the breaking down of medications before our body gets rid of it. And so pharmacogenomic testing became a field that explores how these genetic variants can impact our response to medications and how can we test for these variants to optimize our prescription medications. So pharmacogenomic testing, what it really is looking at is how we metabolize medications. So breaking medications down, typically in the liver. There are genetic variants that can make us what we call rapid metabolizers, meaning we break them down more quickly than we should, or poor metabolizers, meaning we break them down more slowly than we should. As a result of being a rapid or poor metabolizer, an individual can have an increased risk for reduced efficacy or side effects with certain medications. And so we use pharmacogenomic testing to help patients and their providers understand which medications may not necessarily be the best fit for them, or which medications they may need to consider an adjusted dose to mitigate those response risks. So let's talk a little bit about when pharmacogenomic testing might be really helpful for a certain individual. Now, we don't understand the metabolism of all medications, and some medications aren't even metabolized in the body, but there are certain areas where pharmacogenomic testing can be incredibly useful. This includes testing for mental health medications, including antidepressants, testing for heart disease medications like statins or cholesterol-lowering medications, testing for pain management, and even testing for chemotherapy response. For people who are considering pharmacogenomic testing, we recommend this can be done for a variety of different reasons. Some people want to do it as proactively as possible. Some people might say, I'm not on any medications now, but I'm concerned about my future and I want this information sooner than later, or I have a family history of certain conditions where I expect I could need a medication related to treating those in the future, and I want that information now. Other people come into pharmacogenomic testing because it's recommended by their healthcare provider, either because they've had a history of unexpected responses to medications like side effects, or they're on a lot of different medications that may or may not be working well for them. And so pharmacogenomic testing may be helpful for that particular provider to narrow down and optimize the trial and error period with a new prescription or adjusting a current prescription. So pharmacogenomic testing involves a consultation with a genetic counselor like myself. This consultation is meant to help clients understand what benefits pharmacogenomic testing can have for them, as well as the limitations. Like I mentioned, some medications aren't known to be impacted by these genes at this time, and there are other factors that are involved in our response to medications. We also help clients understand what to expect from the testing. Once that consultation is complete and a client is interested in proceeding, we collect a sample, typically a blood draw, and then when the results are available, we connect with the client again to go through their results, some of the nuances, and recommendations related to any concerns or current prescriptions that they have. Pharmacogenomic testing isn't a perfect test. There are limitations. I mentioned that there are other factors that can influence how we respond to medications. These can include things like our diet, whether or not we smoke cigarettes, and other medications that we're taking because drugs can interact with each other. There are also unknown factors to drug response. Sometimes an individual can have a really negative response to a medication that has well-defined genetic influences, but those genes are tested and come back looking normal. So because of this, pharmacogenomics testing is only giving you a piece of the puzzle. It's meant to give more information because more information can help clients feel empowered to make decisions about their health, but it's not going to give all of the answers to all medication response. At Medcan, when we offer pharmacogenomic testing, it does include, like I mentioned, a consultation before and after with a genetic counselor, but the genetics team remains at the client and physician's disposal for any questions in the future regarding medications and how their results can be applied to those future medications. At Medcan, we do have certain membership programs where physicians may refer patients or clients for pharmacogenomic testing, such as dedicated care. And additionally, pharmacogenomic testing is included in the MCare membership. Our genetics team works closely with our dedicated care and MCare physicians to ensure that pharmacogenomic testing results are integrated into their care and used to make prescription decisions that help optimize a particular client's prescription and reduce some of the risks that could be associated with the results. So that's pharmacogenomics in a nutshell. If you are a Medcan member and would like to learn more about pharmacogenomic testing, you can feel free to talk to your Medcan physician about it. Otherwise, you can visit medcan.com/genetics to learn more about our genetic testing services. Thank you so much for listening to this episode of Eat, Move, Think.
This podcast episode is intended to provide general information about health and wellness only and is not designed or intended to constitute or be used as a substitute for medical advice, treatment, or diagnosis. You should always talk to your Medcan healthcare provider for individual medical advice, diagnosis, and treatment, including your specific health and wellness needs. This podcast is based on the information available at the time of preparation and is only accurate and current as of that date. Source information and recommendations are subject to change based on scientific evidence as it evolves over time. Medcan is not responsible for future changes or updates to the information and recommendations and assumes no obligation to update based on future developments. Reference to or mention of specific treatments or therapies does not constitute or imply a recommendation for endorsement. The links provided within the associated document are to assist the reader with any specific information highlighted. Any third-party links are not endorsed by Medcan.